Good morning. I am very, very pleased to be here this morning, and I'd like to begin with a word about what it is that is making me so pleased. To convey that, I hearken back to the introductory comments that David Olds made yesterday. If you remember, he talked about this being part of a team. And indeed, I think that the planning group and the other people here who've been participated yesterday and today would be well characterized as the A team. And I'm really happy to be able to contribute in some small way to that effort. I'm excited about this participation in part because apropos of what we heard yesterday from David Olds about this team effort, I think that this team really is really in a good position basically to distill the collective wisdom, the essence of the collective wisdom about where we can go from here to advance a cause of scaling family-focused prevention, to translate what we're hearing these couple of days to actionable steps that will really make a difference. Really making a difference brings me back to something else that David said yesterday, and that kind of helps me get to the charge, as I understand it, for my talk, and then I can talk a little bit about the specific objectives. David, I was really struck when he said he is pleased to be part of this collective effort that really wants to make a difference, leave the world a better place, but does that in a kind of rigorous scientific approach. Now, that characterization has a lot to do with what attracts me to what I've heard from the program committee about what they want to hear from our work, what they want to most hear about, and that is to convey some basic information about a system, a land-grant-based cooperative extension system that could be considered, along with the other systems we've been hearing about, to make that difference. And from the time I walked through the door, practically, at my university, Iowa State University, when I first met the extension people with whom I'd be eventually working, I was struck by how so many of them really did care about leaving the world a different place. And in fact, the person from whom that statement often comes is George Washington Carver, the guy who helped us learn 1,000,001 ways to use the peanut. And he was at Iowa State University. That is sort of a legacy. It's something that really is part of the culture of this system that we're talking about, the Cooperative Extension System. And most notably, the slogan of the university, as exemplified by that system, is science with practice. So they really care about helping kids and families through those program areas in the system, and they care a lot about doing science with practice. In fact, as many of you know, the Ev Rogers book, Diffusion of Innovation, was in part inspired by research that was through the extension system. It's built to disseminate. It's built to transfer knowledge. So I thought it was worth taking a little extra time to do that introduction. That brings me to the purpose and the objectives. It's about, the purpose is to talk a little bit about findings on the development of systems, most notably the system that we work with, or the systems education cooperative extension, and kind of bring that back around, what we've learned from those findings to next steps, and so all I care about really, even though there's going to be a lot of information on these slides, and I have a few short minutes to present them, is giving you some discussion points, problem solutions, move on to Prosper, the project that is based in this extension system, as an illustrative approach from which we can learn about making a difference in scale. I will talk about some challenges. I mostly reiterate what we've already heard, And that's my excuse for moving through them very quickly and with some steps toward greater impact. So I don't need to spend a lot of time, but it truly is impressive if you think about the advancements that happened between the 1994 Institute of Medicine National Research Council report on prevention and the one that came out in 2009. And we all know this, what the advances that relate to tested and effective intervention across the lifespan development, that interventions that are effective in addressing multiple problems. And as we heard from Stephanie yesterday, we have many of them that show cost benefit. I was particularly pleased with the summary of the evidence on family focus programs in that report. And as you see here, these are some specific outcomes that were delineated and discussed in that report. One of the things I want to make note of, since we focus on universal interventions in all of the work that we've done over the past 23, 24 years, is the evidence we've seen, and this is alluded to in the report, for crossover effects. So the interventions that we test and the ones that are also reported in the literature, in one case, they target substance use outcomes. The putative mediators are these proximal outcomes, but even though the programs are sort of designed to affect substance misuse broadly, and they don't target, for example, a specific type of substance misuse like prescription drug misuse, we see those outcomes. And we see the other outcomes, conduct problems, aggressive destructive behaviors, health risky sexual behaviors. Of course, why? I mean, why? Of course, it's because we address common risks and protective factors that can have primary impacts on socializing environments, and the social network analyses we've done demonstrate that that purported mechanism is indeed operative. So again, preaching to the choir, despite these impressive advances over the last couple decades, we are unfortunately still in a situation where most of what's happening out there is untested. Brian speaks to this pretty eloquently in some way, and the importance of paying a lot of attention to what's being implemented that is untested. And we have often very limited effective delivery systems. So with that as a background on the problem solutions, the context for this conversation, this talk about Prosper and some next steps is based in the work of another team I had the privilege to be a part of, is Task Force for the Society for Prevention Research on advancing type 2 translation research. And this is trying to capture what, again, we already all know, but the fact that we have such a small proportion of total interventions that are EBIs, they're frequently, when they are implemented, they're not implemented with quality, or that quality is not sustained over time, and that is tantamount to having limited impact. The potential isn't realized. And the barriers to that, again, very instructive from the conversation yesterday. There's this commonality in the perception about what the most significant barriers are. So in this paper, the core challenge, and a lot of this very lengthy paper addresses this first core challenge and in two sets of infrastructures that are necessary to advance the field for practice, for research, and how they need to be integrated. So this illustrative delivery system, Prosper, is just one approach, but we've learned a lot through it. It builds on these existing delivery systems, the Cooperative Extension, the land-grant university-based outreach system in every state. It links to the public education school system, and we have a new grant, got one last year, to adapt this to another infrastructure which is developing and increasingly more oriented toward family supports, and that's military families, National Guard specifically. This, in one graphic, captures what Prosper is all about. It's multi-tiered. The action units on the ground work with the community. Units are these community teams. They have representatives and stakeholders from the two systems, extension and public, and then other social service agency representatives. It's really hard to convey what this is. This is a basic structure to convey what this is really all about and how it unfolds over time. Tough with short time, but just to give you a sense of it, one of the key parts of this is, for sustainability, is this team of prevention coordinators that provide ongoing proactive TA with biweekly contacts. It's very, at least that's what they're trained to do, and they serve as a liaison with the university-based team. There is a menu. It was kind of intriguing to think about. Maybe we can get back to some discussion about it later, about this idea of packaging programs. We have a menu. It's a small menu. It's very focused on middle school, family and school EBIs. Among the three family EBIs, the Strengthening Families program is the one that each and every team to date has selected. Another interesting discussion, how that's happened through the technical assistance part of this. The basic idea of what the program is, basic, as I alluded to, common risk and protective factors that are addressed. It's a 7-week, 2-hourly group-based program with separate sessions for families and a joint session for families and kids each of the 7 times, which is critically important. So the community level, the action unit, the team on the ground, this is what it looks like. Small, strategic, it grows over time for sustainability purposes. And they also can expand the menu. So talk about, again, snapshots from the study, just to give you an idea, and to encapsulate what I want to convey through these snapshots of outcomes through this randomized controlled trial, cohort sequential collaboration with our good colleagues at Penn State University. What I want to, the take-home point here kind of picks up on the keynote, that tremendous keynote, Amy, A.K.N., about changing trajectories with developmentally well-timed interventions. And so this is just one of the outcomes through 12th grade, 6.5 years past baseline. We see this is just one illustration, but there are many other outcomes that look like this. We get them on a different development trajectory in this particular case on illicit substance use index. Those time point differences are significant and important, considering this is a universal intervention. The effects are stronger for higher risk kids. Some exciting new, not even published yet, but soon to be, we hope, is there's a research group at PSU that has interest in gene by-environment interactions, and this is, and again, it's about trajectories. The basic point is the DRD4 7+ variant genotype is interacting with the intervention of maternal hostility. So you have these kids that, because of this gene, are presumably more sensitive to their environment. So they have hostile moms. They're more likely to be aggressive. And what this shows is that those shows a difference between the higher risk kids because of the susceptibility to environment because of this gene, combined with maternal hostility and the intervention. This is the difference set that the intervention makes on aggressions 11 through 16. And we want to make a point about cost effectiveness, and the key point here is the efficiencies that are gained with sustainability of an effective system. They learn how to implement better. They get more efficient over time. If as much as we can compare what the implementation costs are with a Prosper system versus not, it's sort of counterintuitive. I remember a CDC meeting where there was a discussion, well, that's got to cost a lot of money to implement via that system. And it's true enough. But what the benefits of doing it effectively through this system, this delivery system, offsets those costs to some extent. It's a lot more complicated than that, but the important take-home point is the efficiencies you can gain through a sustained system that is helping to sustain implementation. So we have the structure I showed you. We have a big bunch of papers, and these are the results. And it's from the first phase of mobilization. We've shown that this can work. It has some potential. So we've delineated the strategies and key challenges at the community level, and going to just again kind of whisk through two key areas: implementation quality and sustainability. Even though there's a lot to say about all of them. And what we do, we cut it every which way but loose when it comes to helping the folk involved in those action units to understand the importance of implementation quality. And we have the system for continuously monitoring and feeding back the information about how well they're doing vis-a-vis implementing with quality. This shows sustained implementation quality. And it's, if you know the work of Dean Fixon and colleagues, this is a fairly high adherence level for our family-focused program. Part of what helps with, we care about quality of the system, the delivery system, Prosper delivery system, along with quality of the implementation of the programs, and we have a benchmarked progress process that the TA providers work through on an annual basis at this point with the local team leaders. We have a model that we show them early on. It's somebody made a comment yesterday. We stress this from the very beginning with the teams, and eventually we structure a lot of work around this basic model: sustain your team, sustain the programs. This is eventually we want them to basically start raising their own money to implement, especially the family-focused programs, and this demonstrates how a combination of in-kind contributions and cash raised increases over time. You'll notice the dip it takes when we had certain external conditions which made it more difficult to raise money. So we've been fortunate to get a number of grants, NEKC, CDC, NIDA, Go Grant, to learn a little more about scaling, moving to other states. This is a basic structure. The main thing is that we have a team that provides technical assistance to the people who are involved in that three-tier structure in other states. And we have done a number of things to better understand. Readiness is critically important. We have an adoption decision-making support system, and so on. The lessons learned overall, these are hugely complex systems, and that there is an incredibly daunting challenge there, especially when the resources are scarce, as they have been, more so since 2008, 2009. And it's just kind of working with the system through this iterative process to keep on top of those challenges. And one key lesson is when you get effective at working with the system, there's so many other problems that essentially go away or become less difficult, like sustained implementation quality. And so further considerations, this lovely egg model is what's in that paper that I talked about with the SPR task force. And yesterday reminded me of some of what we got into when we were trying to figure out how to represent what we need to know to move forward, and we need to attend to these multiple contexts, infrastructure supports, and this developmentally phased process. But the key thing is keeping a clear focus on that outcome that we desire, that population impact, and recognize the complexity of all of those barriers. And that'll bring me back to the final closing point in about 50 seconds. So we delineated all the systems and infrastructures at each phase that are important, data systems, we keep hearing about that, and ones that are cross-cutting across all phases. So there are three basic action steps, and a lot of these ideas have already been discussed, but these are key ones. They are mostly from the paper. Planning and organization for infrastructure development, tying into the ACA and the National Prevention Strategy, Common Conceptual Framework. We had the wonderful meeting to which Lauren alluded, and we talked about a structured exercise, collective team effort, to get clear about what's strategic here with specific stakeholders vis-a-vis all those phases of the process, innovative funding mechanisms, braided funding. I think private-public partnerships are critically important. And this is the two key ones that connect. State prevention finance, integrated state prevention systems with these kinds of financing teams. Some wonderful illustrations of some progress made in the states, and the development and testing and coordination of these scalable systems. So more research on the systems themselves and embedded research that address a multiplicity of really important issues, but that having state and national prevention systems or integrated state systems seems pretty important. Thank you very much.